As the number of COVID-19 cases increase, doctors are noticing an alarming trend in hospitals, a lower number of emergency admissions for heart attacks and strokes. That may seem like good news, but Nine Health expert Dr. Payal Kohli joins me now to talk about why that may be concerning and about the real health footprint of COVID-19, what it really is. So it's good to see you, Dr. Kohli, but I have to ask you, why isn't it good news that the number of heart attacks and strokes are going down? That seems like that would be a good number.
So, Tom, at first blush, we thought so too, but really it depends on the reason for why these heart attacks and strokes are going down. So if you told me that the reason was because people are social distancing, they're living healthier, they're eating at home, traveling less, maybe drinking less alcohol, that would be a cause for celebration. But what doctors worry is that the real reason that the numbers are going down is actually because people are afraid to go to the hospital. They're afraid to expose themselves to the virus, and they may be minimizing their symptoms or not seeking care. Or there may be another group of people that doesn't have access to care because they don't have access to the internet or the telephone, and therefore they can't get to their doctor. And that's what we worry are the real reasons behind why we're seeing this trend.
Well, those patients don't go away. They basically put everything on hold. What is the long-term effect of patients not getting the care when they should or as soon as they can?
So the problem becomes that you take a tiny problem and turn it into a big one. So let me give you an example. When you're having a heart attack, time is heart muscle. So the sooner you get to care, the sooner you can get that blockage opened up and restore blood flow to the heart and maybe have no long-term damage whatsoever. But on the other hand, if these patients are now staying home, their heart attack completes. They have permanent damage to the heart muscle, and that can cause problems like congestive heart failure. So you turned a small problem into a big chronic problem, and we're going to start to see the effects of these problems in the next several months to years.
We're starting to get very optimistic about a phrase we've all become familiar with, flattening of the curve, the COVID curve. But that's just about the ascent. There are other avenues to look at the curve, and there are other curves as well that you say may be almost as important when you talk about a pandemic.
Yeah, so one of the most important things in a pandemic is to really take a 30,000-foot view. And we've all done a great job of flattening the COVID curve, which is the curve of the acute mortality or acute death as a result of COVID. And that's shown here in pink. And that's the people that are dying from COVID directly. But as you can see in green, those are the people that waited out their heart attack or their stroke at home. And they're going to start dying or having problems in the next several months to years. And then there's a third curve shown here in blue. And that's the people with chronic medical problems like hypertension or diabetes that are not getting the routine care that they need, like eye exams or foot exams. And then the curve shown in red is the mental health problems that are going to emerge from this epidemic. So you can see that a pandemic really causes so much more than just the acute damage. It actually leaves its lasting effect for many years or months to come. And the reason I show these curves is because I want all of us to really understand that we don't just need to flatten that COVID curve, but we need to continue to flatten all the other curves as well, because that's going to be the next set of problems we're going to have to deal with if we don't do that today.
Well, statistics, numbers, testing, all of these things have become difficult to really get a handle on the fly. That last curve, when you talk about the long-term effect of mental health, that may be one that there is no number for, so it'll be something that we certainly will have to keep an eye on, but that is down the road. Dr. Kohli, we always learn so much. Thanks for taking the time to visit with us again today.